Okay, hello everyone, and thank you for joining us during our seminar on responsible AI in medicine of the Samueli Initiative for Responsible AI in Medicine. And I guess a lot of you already know a bit about our activities. If you haven't still followed us, you can do that in different social media, Facebook, LinkedIn. We have a pretty lively WhatsApp group. If you're not there, you're very much invited to join us. I'm very happy to have here with us today some of the very active members of our initiative. First and foremost, my dear friend and colleague, Dr. Amir Tal, was probably known to most of you, and will probably share with us what's up next in this seminar towards the end of this meeting. We also have our newest member who's really helpful to us, Adas Rubin, who's probably in touch with some of you. And before we begin, just to get you a sense of what we're doing over the past month, you might have already watched. So to begin with, we've already said that over the year that also that we're working, we really strive to be very interdisciplinary, to connect different parts of our campus, but also different professions, different expertise, different fields. And by doing so, we hope that those who are dealing with the challenges of technology will be able to share their thoughts with those who are dealing with the challenges of medicine, and those who are dealing with the challenges of philosophy or social issues will be informing their colleagues and vice versa. And we feel that this is probably the best way to go forward in this kind of discussion. And doing so, we think an international approach is the most relevant one, specifically in a field like a developing technology that influences us as a global community. And even if it has local implications, a lot of the issues, a lot of the development have global relevance as well. And I think today's example might be an interesting one, as we're going to talk about things that are probably done in where Dr. Nakasi is working in Africa, but does it mean that they're local in essence or not? Are there specific and unique aspects to consider? These are questions. I'm not sure. I don't have answers before the discussion. I think it'll be interesting to hear how people think about those matters. One of the things that we're happy to do is to support new research, new projects, and ideas. And in this spirit, I'm happy to share with you our grant winners' names and topics. I'm not going to read through everything, but just to get you a sense of how unique and interesting the ideas are. Then one of our research grants is actually a combination of artistic displays in the art museum and how they relate to the concept of empathy and empathic well-being using artificial intelligence, for instance, in medicine. Others relate to concepts of genomics and how those may be creating questions of responsible AI. Others look at clinical decision-making, privacy, and so on. We also have different research groups that started to work, or discussion groups, and you will hear more about these projects hopefully in about, I'm not sure about it, but we're considering maybe on March to do an international conference where the people who are working on these projects will present their main, let's say, outcome and so on. So it's nice to support the work and also then maybe gather together and hear what people are doing. So this seminar, we've already had quite a lot of interesting people talking about different aspects of responsible AI in medicine. And I think to some extent, maybe Rose, you're possibly the first engineer, first expert, like real expert in a way, in the technical and medical issues combined. And I'm happy that you took this challenge to connect your work with ethics and responsibility. And let's see where it takes us, where the discussion takes us. I'm also really happy that we have with us from, I think it's the School of Public Health, Dr. Shlomit Zuckerman. I hope she'll have some interesting insights. Let's see where we take things. So without further ado, I'm happy to present our speaker. Let me just say that we connected through the activities, through the WhatsApp group and so on. So in a way, really our intention to create this international community is starting to be fulfilled. And I think that's really the essence of what we're hoping to do. And I'm looking forward to hearing you. So our talk today by Dr. Rose Nakasi, a computer scientist and artificial intelligence researcher, also a lecturer in the Makerere University and head of the AIHealth lab there. It's in Uganda in Africa. And she's going to tell us about, I guess, the projects, the malaria projects and other projects that relate to diagnosis and surveillance of public health related matters. So Rose, you're welcome to present, and thank you for coming to speak to us today.
All right, you don't need to go back to my introduction. Irene has done the honors of doing that justice, and I'll speak specifically to a topic that I passionately have been undertaking for quite some time, and that's artificial intelligence in health. And when Emil reached out to me to be able to give a talk today, especially on responsible AI, it's one of those topics that intrigue us a lot, and with the general overview of the work that we're doing to be able to use artificial intelligence responsibly to impact the people that we develop these tools for. So I want to thank the initiative here on responsible AI in medicine for gathering us globally to come together and speak towards a topic that unites us in the work that we're doing, to share experiences on the work that we're doing with an overall goal of improving healthcare outcomes, as well as positively impacting our patients. So I'm very grateful for the invitation to speak. And I hope through this engagement, we're able to learn a few things from each other, as well as the experiences on the work that we've been doing. About us, at the Makerere Artificial Intelligence Health Lab in Makerere, and our goal is mainly to address the pressing healthy challenges effectively. This is to leverage on the cutting edge technologies, but we're doing this through collaborative and interdisciplinary kind of research to be able to revolutionize healthcare delivery. So our group is a mixture of computer scientists as well as artificial intelligence experts, but together with those in the healthy domain to be able to understand the pertinent domain problems that are in the healthcare systems, and then to be able to leverage some of the technologies that come with artificial intelligence as support tools to improve patient outcomes and ultimately make a meaningful difference in our lives. With the mission, with our vision of transforming healthcare through innovative artificial intelligence solutions. So the image that you're seeing there was one that we took while we were launching the lab. And if I could just make a mention of the people in that picture, we have government officials. The lady in there is permanent secretary under the Ministry of ICT. We have healthy practitioners and experts. We have artificial intelligence experts, as well as Ministry of Health representatives, together with the Makerere administrators. So we believe that through this collaborative drive to use innovations in artificial intelligence research, would be effectively addressing and overcoming the most pressing healthcare challenges. And that is the mission as to why that drives the work that we're doing here, to be able to involve all the relevant stakeholders to come together, and then we come up with impactful researches that leverage on the use and capability of artificial intelligence to drive and overcome some of the most pressing healthy challenges. And to be able to do this, we are not just theoretically thinking about artificial intelligence approaches, but we want to develop practical artificial intelligence approaches to drive healthcare delivery, not only in Uganda, but across board, and to learn from each other through an interdisciplinary collaborative approach while driving innovations and adaptation to artificial intelligence solutions. We want to understand comprehensively the power of artificial intelligence and put it to use and its capacity and capabilities in healthcare. And we are doing this through a research-based kind of approach, as well as evaluating the tools that we develop to be able to meet the demands in healthcare. While I was invited on this talk, and it was about what is artificial intelligence in health and where have we been able to appreciate the use of artificial intelligence, what was the motivation for the work that we're doing, what is the hope, the hype, and the promise and the perils around artificial intelligence in healthcare, and how can we be able to effectively leverage its capabilities, especially in promoting good health. And specifically to how we are looking at it from our lens at the moment is that we're looking at how can we be able to control the diseases, and the major control measure is usually through diagnostics, because if I'm given a wrong diagnosis, then probably the treatment will also be a wrong treatment plan, and then the outcomes will also be not good. So the ways that we're doing this is that we're looking at the overall disease management protocol, and then try to look at hinges in which we can be able to evolve artificial intelligence and infuse it in to be able to support the disease diagnostics, to then prior inform the right surveillance and as well as treatment plans for a healthier population. I've looked out for the different ways in which potentially we can leverage artificial intelligence for health, and this is for the general community to appreciate in so many ways, not necessarily in the work that you're doing here, but to be able to appreciate in ways that it has been able to revolutionize and transform healthcare. Usually when you look at self-management, and this is one of the critical aspects to look at and appreciate the power of artificial intelligence, especially in health. When you have, we were recently faced with a challenge of lockdown through COVID. And if I can share an experience that we had here, that was, we had a lockdown, all the healthy care systems were locked down, and movement of people was rather very, very difficult. And rather than just having actually people die from COVID, there were so many other challenges that led to actually huge mortalities around other different ailments that people had, because they could not be able to even access correct medical care. But we believe that if there is an artificial intelligence solution that can be able to reach out individuals, even in scenarios such as that, to be able to do self-management of the ailments that they have, we believe that that can be one of the major breakthroughs that AI could bring, especially in the aspect of health, and in a way that could assist people, especially with cognitive disabilities. If we think about it, how artificial intelligence can be leveraged to assist people with cognitive disabilities. We've had scenarios where, and a colleague of mine is developing actually a natural language processor where they are looking at transforming signs to be able to be able to communicate with each other effectively. So this, in a way, is translating the sign language into natural language processing to be able to communicate in a way that people without disabilities are able to communicate with those with disabilities with a lot of ease. And that comes again with the potentiality that's provided by artificial intelligence to support in that realm. We've seen it work around clinical care teams in diagnosis and risk assessment, and I'll share more on diagnosis and the work that you're doing here and how it's transforming disease diagnosis, but as well as assessment of risks before even the disease gets into either a worse situation or to have a symptom-based diagnostic before the patient even reaches the core diagnostics. It has been able to learn patterns around what the patients present as symptoms, to be able to even analyze symptoms and then relate to a given diagnostic that is relevant for such a sickness. But as well as personalizing treatment plans. We've seen scenarios here in Uganda, for example, and this I'm speaking from experience on the aspect of malaria, that we have had a ton of different treatments that are given for one major disease, and that's malaria. If I can single out a treatment such as Coartem as a treatment for malaria, we have seen different individuals react differently to such medication, and there are so many factors that lead to that. But through the transformative capabilities of artificial intelligence to be able to look at various aspects that might contribute to drug resistances and probably personalize treatments for individuals, we believe that that's one good way that we can be able to leverage its capabilities to support better patient outcomes. And with the tons of information that is being captured, especially in the electronic health records, again, we can be able to leverage on its capability for information retrieval, analysis, and then visualizations to be able to support on better interventions with consistent accuracies that come with artificial intelligence. Further to that, we can also use it for disease surveillance, and specific to the work we're doing, which I'll speak more on to, is that we are able to, capture disease patterns from different environments, and then doing spatial temporal analysis on it, we can be able to avail real-time disease surveillances. And we believe that if automation comes for disease surveillance, and we believe that intended all required interventions can be provided, especially by stakeholders, timely, to have patients receive the best kind of interventions that may be required, rather than waiting for longer to get even such scenarios. In disease surveillance, I want to speak to the system that we are currently using here in Uganda, and probably it may be different from other contexts, but I want to share the context here. Is that when you look at the electronic health management systems here at the different health units, the systems currently are not automated or are not digitalized. Rather, the records are paper-based, so they record results or patients that come to a given health unit, and then record those manually in the books. And then once that is done, then they curate that information and augment it for over a week and then a month before it's then captured digitally into the electronic health records. So if an intervention is going to be taken over a month or even months before that information is entered into the digital health systems, then we know that probably also the intervention is going to come a lot longer than expected. But if we can be able to come up with surveillance systems that are able to provide information timely, then we believe also the interventions in the end will be timely, in a way of providing, kind of responsibility to the reportings that we do, so that our patients are able to receive real-time interventions. We've seen scenarios where, in terms of public health, we have monitors for air pollution, and that's one of the major health burdens that we have. Air pollution coming in from all sorts of vehicles, all sorts of dust and all that is surrounding us, but we don't even know, we can't even equate how much of it that we consume and what effect it may have to our health. But if we can be able to leverage artificial intelligence to monitor our air pollution out there, and those are some of the use cases that are being under development to be able to support quantification of the amounts of those that can be actually dangerous to our health, and then providing timely interventions again in that kind of aspect. When we think about the considerations for responsible AI in healthcare and why we really need to be keen about considering such aspects for the overall outcome, we know that, well, there is a transformative role of artificial intelligence in promoting good health and well-being, and it has been evident in some of the works that we've been doing. But however, if we are to successfully integrate artificial intelligence, there are certain careful considerations that we need to put into consideration. And we believe that if those are keenly taken care of, then we shall develop an AI tool or an AI solution that is able to provide responsibly the goal for which it is intended to. And in democratizing the use of artificial intelligence in healthcare, whatever AI solution that we are developing, we need to be keen that that artificial intelligence is one that is going to stay good and providing responsibly. It has to stay good so that we advocate for responsible artificial intelligence solutions, so that the adoption and trust in the solutions that we believe is put into consideration. One of those aspects that, from our experience, that has been one of the keys, the healthcare data. And we know that artificial intelligence models in their own sense are usually data intensive. So with the lots of data that comes with what are the access capabilities that we have to such data, we know that this being healthcare data, that there are so many aspects around it in terms of the quality of the data, in terms of the authorizations that come in from the healthcare providers, the biases that may come with it, because sometimes it may be, prone to sensitivities, but also bias may come in because of the subjectivity, or even the data features that we capture out of that data may also bring in some certain aspects of bias, and how it is also reported from the way standardly it's meant for in the healthcare system, and how the AI tool is going to consume it to be able to report it is also something that we need to be keen about, especially when we're looking at healthcare data. But specifically here in the responsible aspect of it, we always look at, are we taking into consideration the ethical considerations once we're using someone's patient data? And are we being cognizant of the fair principles around the data that we're using to provide and use in our artificial intelligence models to provide solutions? The other aspect that has always been keen, and one that we found very pertinent, is the transparency. Transparency is at different levels. How one is going to get trust into the artificial intelligence models that we develop, especially for consuming in the healthcare systems, and specifically health, because one domain around it and that we need to be keen about is that is one of the most sensitive sensitive domains, because when we talk about health, we're talking about people's lives. And as well, the solutions that we are to develop should always be cognizant of the patient or the person in mind as we develop them. So we need to have transparency in the data that we use for the models, but as well as the algorithmic transparency. There was a talk and discussion that I was in one time, and one was asking, if an AI model makes a mistake, who is responsible for taking up, the blame for what it has done? And so as we think about the coolness of artificial intelligence, are we able to audit its transparency, its what's able to do? And again, that is going to depend on factors such as risk, performance, and user trust and liability. Usually from our end as computer scientists, we're always keen about improving the model to achieve a given level of accuracy. But then at the trade-off of sometimes aspects that may be brought in, or that may bring in bias to improve the accuracy. But at the end of it, or when we are doing responsible AI, especially in health, we need to have that audit aspect in mind, that whatever the data we're using should be transparent, as well as the algorithms that are being developed. So that's one key aspect as developers of artificial intelligence systems in healthcare. We need to be quite vigilant about. We these days have augmented intelligence, and that's now what is the level of automation, especially in healthcare. If we want to automate, for example, diagnostics for diseases, at what level of automation are we going to say that, okay, this is enough? Should we have a human out of the loop and let the automation be automatic in all the processes that we're doing? All from the time that we getting the aspect of the problem to research about, we need to involve probably the domain experts to be always in the loop, guiding all the processes until the final validation to when it gets to the patient. So what is the level of automation that we need to think about? Is it the near time focus on having it as an augmented intelligence system, or having it fully as an automated system that is able to do each and everything, and then having the human? And what would advocate for is really to have it as an augmented intelligence, one that is just like a support tool, especially in the different domains that we're developing them for. And I believe that's one key aspect, that we don't need to get overexcited and think that, okay, let's leave the AI to do each and everything, but rather we need to have it as an augmented intelligence to the domain experts that may be few or may be limited in some ways to produce the overall decision that is intended, especially in health. When you look at the regulatory environment, that is one key thing and aspect, because we always operate within country regulations, continental regulations, and also in the medical world, they also have their regulations. So what is the regulatory environment around the development of artificial intelligence in health? And that's because if there is an enabling environment, then we believe that AI is going to evolve very fast. So we need to be keen about, okay, where am I developing the artificial intelligence tool from? Is that an environment enabling in terms of the roles and regulations around it? Is it going way beyond what it's supposed to go to? So what is the threshold of the right regulatory environment to be able to develop an artificial intelligence in? And the goal then should be balancing innovation with appropriate oversight and protection. And that leads us to asking ourselves, in the different environments where we did, do we have data policies? Do we have regulations around the tools that we're developing at country level? I know that's also something that we need to take up. I know that the UN is at the top of it, trying to come up with regulatory policies, and as well as different policies around data and algorithms that we develop. But then it's going to be consumed at country level and at healthy facility levels. So are we thinking the different environments to, at the end of the day, have a balance between the innovations that come with artificial intelligence, as well as appropriately applying them, especially in the healthcare sector, is one thing that the conversation should now be directed to, so that we have a comprehensive environment that is enabling, but as well as protective, especially putting in mind that responsible use should always have a people in the mind along the way. Not just the regulatory environment, but also the deployment environments. And as you look at the use case that we're developing apparently, where we're using smartphones, we know that, of course, there are now smartphones on the market, but these smartphones keep evolving, as well as the different tools or devices that we use to either capture data or integrate the models onto for the overall use of the tool outside in the environments where they are meant to. So with that kind of deployment environment, which are evolving with different variations, are we able to, do we need a robust and mature underlying information technology strategy that's able to, go and capture all those different variations and evolving environments that we live in, to make sure that, for example, an AI solution that was developed in 2001 is going to remain relevant in 2030. So those are some of the critical aspects that should be considered, especially for responsible AI in health. If we to look at the key attributes of artificial intelligence in healthcare, whereas it is designed to enhance human intelligence and the patient-physician relationship, rather than replacing it. And that's the thing that I was talking about while we were starting the journey of applying artificial intelligence in healthcare. One of the challenges that we had, especially coming from or looking at the multidisciplinary kind of research between artificial intelligence experts and as well as the medical practitioner experts. Each of those fields have their own standards of operation, and sometimes they concur, but sometimes they actually don't agree at some point. So there was need to strike a balance to have all the fields be able to communicate to each other rather than fight each other. So there has to be a very good relationship or working relationship between looking at the AI as a support tool, especially in healthcare, and then involving all the field experts to develop a healthy relationship so that we're not just replacing the experts, but rather augmenting and supporting the work that they are doing. And that is one of the things that we keep being asked, especially when we go out in the field, isn't this tool actually going to replace my job? And that is one of the feedback that we usually get as a critique of artificial intelligence. But one of the things that we've always advocated for is that, this is just a support tool, just like you have all the other digital support tools that you're using. Artificial intelligence will be one of those that has come to, efficiently support the work that you're doing rather than replacing completely. And, we have to keep up with the best practices, especially looking at, we had to learn the manual of, for example, if they are doing diagnostics, what's the protocol that they follow, so that we keep with best practices out there and rather, support each other in a user-centered design, trying to look at the AI tool as not just a tool, but a tool that is going to be used by a human being. So how can we be able to have best practices for trusting the AI tool, especially by the human that is out there in the field? And the other attribute is that AI systems must be based on risk of harm and benefits accounting for a host of factors. We usually want to look at what the model is performing or what the artificial intelligence model is performing is on a given task. But sometimes we don't usually put into mind is that how can we be able to assess the risk of the performance of the AI, especially when dealing with human health. We need to always, at the back of our mind, as the AI solution is coming up with this accuracy or with this solution, can we be able to assess the risk of harm that may be involved? Even if it's achieving 99%, what is the risk of that 1% that is remaining? And that is very good because it accounts for a list of factors that is going to be the one that is going to create trust and confidence in the solutions that we come up with. In the initial, again, as we were starting AI, especially around deep learning, when it has just come up using this convolutional neural networks, in the initial, we were developing those models from scratch, and there was nothing like, an explanation or in the background of what the model is actually doing. And while we were presenting some of our fantastic findings with the medics, they were usually asking, so at this point, at what point is the model doing ABCD? And because of the black nature of deep learning models then, it was really even rather hard to explain all those complexities. But with explainable artificial intelligence now, we should encourage and embrace to reduce the black box complexity of models and to make it easily understandable and interpretable, especially with people who are non-experts in artificial intelligence, rather in a way to appreciate each other and the work that the model is doing. It is always good to have an explainability of those models in the group so that at all ends, of the domains, we are able to communicate effectively and understandably, and everyone is comfortable. Because once a patient or a doctor is comfortable with the tool, then we know that adaptation of the AI tools will be quite very easy. Validation is the other thing, is that whenever we develop the tools, we go back out there to validate them and get probably human experts opinions about what the model is actually doing before we get so much excited about the tools that we're developing. And that's one key thing that we've always done, to be able to involve humans along the way, human experts in the rope, especially even at validation, to see if what the model is doing is actually what it is meant to do. And that is a very critical thing, because once there is a good validation plan, then we believe that that is going to be the start of advocacy for any AI solution. And that should also conform with standards for reproducibility. Can we be able to reproduce the results that happened like 10 years back, so that if someone comes to audit what the model is doing, we are able to make a step-by-step way, and that then requires documentation of whatever step that is involved in the development of the AI tool in healthcare. Because that is all part of, confidence building, and as well as comfort, that once a person is able to reproduce the results and be comfortable with them, then we believe that that's one good way of advocacy for responsible artificial intelligence in healthcare. When we address certain aspects of bias and avoid introducing and exacerbating healthcare disparities, and this, I think I mentioned it while we were beginning this conversation, on how are we addressing the bias aspects in the data, in the models, and in the final state of the model. Do we have a quality assessment tool to quantify the level of bias, to even be able to capture it, that before we produce out the results out there, we're able to even communicate the bias that comes with it and quantify it? Once we do that, all that is all in ways of safeguarding the patient and building confidence into the solutions that are being developed. But at the end of the day, I said that responsible use should always be able to advocate for people in mind, and therefore we need to always be keen about safeguarding patients and as well as their privacy interests. So before we use any kind of data, we need to be critical about, are we being so cognizant that there is no patient information shared out there to, compromise their privacy, compromise their interests, and is there anything that is there in place? And I'm glad that we have now a responsible AI in medicine initiative that is going to drive those considerations. That before we even report about the good things that AI is doing, is there a tool that can be developed for us to assess the responsibility, or that will be able to capture all aspects of bias, that are individual privacy interests, to be always at the top of the radar before we even try to use any data. And therefore, as we evolve, if we evolving systems around that and augment and scale the capabilities of physicians, the broader healthcare team, and patients in achieving the quadruple aim in healthcare. So we don't just need to be just on one end of thinking about how is the AI performing or how good is it performing, but you need to take into a lens of so many different things and know that, okay, the AI is just an augment tool to support, one, the capabilities of the physicians or the medical experts and the entire healthcare team to be able to do what they do best, to provide the right patient care at the end of the day. And that should be always the goal for using artificial intelligence or leveraging on it to support the healthcare systems. Of course, there are opportunities that can be explored for those who may wish to, or those who are already leveraging it in diagnosis. There are tons of data and or patient and produce insights. We can produce best practice treatments, additional time for healthcare practitioners to spend with patients instead of, lying seated back and looking for those pathogens, for example. under the microscope? Can the AI tool be able to support them on the interpretation of what they see under the microscope, so that the time that they might be using to spend more looking under, that time can be apportioned actually to spending with patients and giving them better patient care? And then you want to improve patient experience so that when I go to a hospital, I'm able to get the timely diagnostics, the right treatment, and giving a patient that right care that they need. And we believe that that is going to aid their behavior change or the way they perceive about hospitals, and then treatment compliance, because of late we're seeing so many cases of drug resistances, and probably if AI is put to use, some of those hindrances can be actually toned down. So I want to introduce you to one of the projects that we are undertaking here in Makerere, and that is on leveraging artificial intelligence for mobile microscopy. And here the motivation was based on some of those pressing needs, health challenges, especially in our context. When you look at a disease such as malaria, it's one of the third, Uganda actually particularly is the third contributor of malaria globally. So you see that there is a very big healthy challenge around some of the diseases that we are typically looking at. When you look at cancers, again, we have, I think, the 7th highest burden. And so some of the motivation out of the work that we're doing here was pushed by the major pressing health burdens that we have. And through the use of the microscope being one of the gold standard WHO recommended diagnostic tool. And that's where we wanted to come in to be able, one, to leverage on the existence of microscopes, especially at almost every public health unit here. We have a microscope, but the bigger challenge is actually the trained experts to be able to support the use of those microscopes in the different health units. We have so many patients, for example, malaria patients that are coming in to be able to get a correct diagnostic. So, and if you're to leverage on the WHO set standards, which do not allow the technicians to view more than 30 slides a day, they have more, and usually now the incidence is even higher. So the patients are too many, and if the technicians are to strain their eye to look out for those pathogens, it will be strenuous, and it will then mean that very few patients will be diagnosed in a day. And that is why in some instances they rely on aspects such as, symptom analysis to be able to, give a diagnostic, or rapid diagnostic tests, which are sometimes do not have high specificity, especially when it comes to the diseases, if it's at a low parasitemia. So in that case, through that motivation, and also with the fact that now smartphones are almost everywhere, we wanted to leverage on that capability and existence of such tools to be able to support the few trained experts at the health facilities. So in here, you can see that what we have done, and our proposition was, can we be able to provide an attachment of a smartphone onto the eyepiece of the microscope? And we are doing 3D printable adapters that we attach to be able to capture whatever is under the microscope to come onto the smartphone. And then using computer vision, we are able to, learn the patterns. Collaboratively, we're working with technicians, especially from the referral hospitals here, to characterize for us the objects of interest. And in this case, it could be the malaria parasites. In the pathology, we're looking at histology of cervical cancer. And so we're working closely with pathologists there to be able to characterize for us some of these objects. And then we leverage on the power of computer vision to learn the characteristics of those to support the correct diagnostics. So part of the work under the Ocular project is that here we're looking at diseases such as malaria. Initially, we are just looking at malaria parasite detection. Then it's scaled way further to look at aspects like malaria parasitemia determination, where you're looking at quantifying the magnitude of the malaria. And then later on, it's scaling now to tuberculosis and histology of cervical cancer. And all that is streaming to come up with a decision support tool to reduce time and improve accuracies in disease diagnostics. We're developing a mobile application, but as well as a web-based tool to support, especially at the points of care, to do diagnostics. Even when we don't have an expert on ground, to be able to confirm through a telehealth application, we believe that this is going to again augment the few experts that we have in our settings, to be able to even send it wherever the technician or the expert is, to give an expert opinion for a confirmation. So even if there is no expert on ground, or especially in the remote health units, we believe that this will come way further to support that telehealth system. Then through our NIH supported initiative that is on the DS-I Malaria project, we're even scaling it further to look at real-time disease surveillance and modeling. We know that especially malaria is a vector-borne disease, so it has an ecological system where it survives. So when someone is diagnosed of malaria through our platform, can we be able to look at any other information around them, for example, the ecology or the location, and then the time, their weather patterns that are contributing to the prevalence of mosquitoes that will contribute to malaria diagnostics. And that is in a way going to support further concretizing the diagnostic accuracies through the detection model, but as well as, on the other hand, even be able to point into a health management system directly. Once diagnostic is made, then it's in real time sent into the electronic health management system for real-time capturing. So we believe that if these electronic health management systems are receiving real-time data, then we believe that any analytics on it will provide timely interventions, especially from the stakeholders, to give a holistic surveillance and diagnostic tool that the Ministry of Health can be able to take up to support the control of malaria or all the diseases that we're looking at in our ecosystem. So we're doing that through curating as many different data sets for given aspects, and relying on the fact that artificial intelligence models are usually data hungry. We're trying to curate and make accessible data sets that could support the diagnostic tools that we are developing. But what are some of the experiences that we had and that we've had away from just the success stories that we have come up with? Of course, there are samples, and these are some of the things that have actually pushed us and motivated us into the different modifications and improvements into the systems that we're developing are concerned. There are usually variations in objects of interest. At first, the ultimate goal was just to look at parasites, but then along the way we need to quantify for parasitemia, and then different other objects come into play, like white blood cells with totally different morphological makeup. So can we be able to develop an AI tool that is able to look at the multi-dimensions and variations that come with the objects of interest that we want to capture? And that made that we needed to come up with multi-object detection tasks, which is very interesting topic, especially in computer science. And then for the variations in data capture, we have been dealing, especially in a controlled ad hoc system. But while we were taking these tools out in the field, they were, it was a totally different environment. And with environment, I mean different models of phones, different models of microscopes, different settings altogether. Which varied. So along the way, we're trying to now come up with a comprehensive, robust tool that is able to capture all the different environmental settings, so that at the end of the day, we're not just producing a tool that is going to be, ad hocly in a limbo, but rather one that is going to address the healthy challenges out there in the field. And that's one good experience that we learned from, and we're trying to make improvements. So what are some of the standardizing solutions that we're trying to develop, as well as we look at the outlook of the different environments and trying to capture every aspect of it. We're trying to also now coming up with benchmarking AI solutions that can actually speak to the disease diagnostic and surveillance of the disease. We have already documented standard benchmarking document and submitted it under the ITU to be able to look at now a standardized and benchmarking way. For example, if we are to deal with AI diagnostics for malaria, can we be able to come up with standards that should be followed to be able to come up with those solutions so that they are reproducible and they speak to the real field that these tools are to be adopted in. And so in this document, we are trying to look at aspects of, can we be able to standardize this certain aspects or around data, the certain aspects of equipment that we use for curation of this data, the certain types of models, can they be, is there an evaluation tool or framework that is able to evaluate and speak to the right model that will at the end of the day be the best one in a given setting or in a given environment. So we believe that with this guiding tool, and there's so many, and I'm glad that while we're speaking or in forecast under the ITU focus group AI for health, and that's where also ethical guidelines are coming up. I saw the work that is Raise is doing for WHO to also come up with guidelines under ethical guidance for some of the tools that we're developing. But all that is intended to be able to standardize and come up with benchmarking solutions that will speak and guide the further developments of the tools that we're developing, especially for AI in healthcare. For the perils, of course, there is still challenges along the way that we're facing, and moving forward, we think that if we can be able to check on the lack of enough data sets, while we're beginning, it was just a limbo. There was no data out there that we could, bring to the local context. So we want to have as many data sets as possible. So if there is any data sharing platform or chance that there is, that should be very good, because we are enabling an ecosystem where we need to develop tools that speak to the environments where we're developing them for, enabling government policies. In Uganda, we don't have yet a formidable policy, especially on the AI implementation in healthcare, and I believe that lies on our shoulders, but through a collaborative initiative such as this, I believe there are so many things that we can, be able to share to guide the policy developments in whichever jurisdiction we all come from. We've not had so many open discussions, especially on ethical implications of AI in healthcare. There are conversations that are now starting, and through these initiatives, I believe that we shall be able to support and understand the ecosystem and the entire implication of ethical AI, because once we capture that right, then we are on a journey for correct adoption of the tools that we're developing out there. I talked about the attitude of healthcare practitioners, and it also is going to involve a collaborative effort of us appreciating the work that they are doing in healthcare, but as well as them appreciating the capabilities that come with artificial intelligence in supporting their workflows. So in that, there is still skepticism, but along the way, I believe with continued discussions such as this and coming all together, we shall be able to appreciate each other and then augment the works that we're doing. And I believe that, I don't know if we have practitioners that are in healthcare here, not specifically with AI, but if we have such, unique conversations coming, bringing us all together, we believe that that will be one roadmap to appreciating ourselves, as well as the insufficient infrastructure and poor yet expensive network connectivity. So in different contexts, some places have better connectivity, and in some contexts we have poor connectivity. So in my own context and experience, we usually have poor infrastructure. And especially when it gets out in the remote areas, you even sometimes realize that we don't even have any internet connectivity. And whereas we are developing tools that sometimes require electricity or power, that require internet connectivity, that requires computational capabilities, So along the way, there is that infrastructural limitation in some contexts, which need to be holistically understood. But as well, we try as much as possible to also leverage that the tools we are developing are able to suit and fit within the ecosystems where we stay, but while also encouraging our governments to be able to, get into the conversations and support the infrastructure to support development of useful tools for our ecosystems. With the changes in technology, that I think I spoke to it, where you have, a phone of 2011 and a phone of 2030, having all different variations. So can we be able to evolve, to develop evolving models that are able to, move with the different variations so that we don't miss out on the right accuracies that come with the tools, and make them dynamic so that we're able to capture the evolving changes, not only in technology, but also in data, in tools, in devices. I mean, technology keeps changing, but also environments keep changing. So are these tools, are we able to audit at every step that we are moving and updating the models that we're developing to move with those changes out there? Yes, I want to thank you once again for the attention and for the opportunity to speak.
Thank you very much, Rose. That was very comprehensive and interesting. And if you could stop sharing so we could see each other, and I invite everyone to, if it's possible, to open their cameras so we can conduct it in a form of a seminar. We have exactly 31 minutes for our discussion. And with us today, there are people from different fields. I mentioned one of them, bioethicist, actually also an expert in risk management, and also touching on public health related ethics matters. So I think if that's okay with you, Shlomit, I didn't tell you exactly what's going to be because I didn't know. But I think sometimes just hearing things out and then discussing them is potentially the best way to engage in meaningful conversation. So if you have some thoughts, ideas, questions, please, the floor is yours, Shlomit.
Also, you like to keep me alert and oriented. So you wanted me to experience that. Okay, so I actually thank you so much for your talk. It was really interesting, and in particular, it was interesting to me to hear those things coming from, the part of the world where there's a history of mistrust from the public regarding, how things are being provided to them, even when we talk about malaria and how, people who are basically need to get diagnosed and surveillance, they probably, and I'm talking about the trust of the public regarding those things. So my question is, when you are trying to get the public part of these, AI really, really important and inspirational initiative, I wonder if you get, or you think you will have to confront the public mistrust regarding the diagnosis and surveillance using AI, because I know there is some of it in the Western world as well, but you have a history of HIV trials that people really didn't feel that they were treated the way they should have during the trials, as opposed to people in the Western world, or the Ebola in 2014, where people basically didn't get treated until the disease arrived to the Western world. And I wonder, in case if this trust is a big issue from the public when you try to do those things like surveillance and diagnosis using AI.
Thank you very much. And that's a very good question. And it's not just the public mistrust that we had a challenge with even before, but even the experts themselves in the first instances of our research. It has been an evolving process to even bring, especially on board, the experts to be able to trust in the work that we're doing. And one of the ways that we've been able to achieve that is always involving them in the loop from the time of conceptualization of the problem to idealization, to data collection, to annotation, what the model does, take it back to them. I mean, it always goes back to, can you show me how it's done so that I can appreciate it? And that usually requires some level of patience, especially from our end as the model developers, but also to have a listening ear. And one way that we are doing this is that every step of the way we go back and then show them and then get them to ask questions and involve them in different talks. I believe that is paying off to a certain level, but now when it comes to now the public, the entire public and the community at large, one of the things that we're doing right now is that we have a community engagement plan. And this is in a way that can we be able to now use, especially the village health teams, to be able to, we train them and then they get to know the message. And then we want to do now a community-based, kind of engagements with them, to listen to them, but as well as try to showcase and demo the work that we're doing. But also sometimes they don't understand even when you talk about what is AI. To some communities we've gone to, they don't even know these translations, for example, in English. So we want to even bring that down to a level where we can now be able to do language translations, to package the information out there for them to be able to understand in the languages that they're able to understand, in a way of, trying to build trust, which is already broken, and like you've highlighted. So it is a process that requires us patiently to work through them and get to involve them and showcase the work that we're doing and get to them in ways that they are able to understand the technology as much as possible. And that involves, bringing them into engagements, into communication lines that they are able to understand very appropriately. I know it's still not so, we're not yet there, and I know it's work in progress. It's going to be hard, and patiently we need to take up that role to make sure that they are able to appreciate the work that we are doing.
Thank you. Now, first, if anyone has questions and so on, you can raise your hand or just let us know. So feel free to do that. And while you're considering what it is that you want to say or ask, so first, Rose, I want to really thank you for taking the time to actually think about the ethical aspects, because in a way, when you do the work that you do, to stop and to consider these social aspects, I mean, I'm sure to some extent you've done that even before we asked for this challenge, but I think to go through the literature and to think how it applies, it's not something that people automatically do because we're busy with our daily work, right? And to think about the international and the local implications is something that I think is very useful and important. Now, so you present the different aspects that are usually considered when we talk about responsible AI in medicine. One of the first one you mentioned was related to bias or inequality. And these are issues interesting generally when we talk about health. And so I was thinking, so you said that Uganda is the third contributor of malaria globally. So what I was hearing, just let me know if I'm hearing correctly, if my interpretation makes sense. This is a very important issue locally, first of all. It's an Uganda issue. A lot of people are contracting malaria, and it's a serious disease burden, and it's a risk to people's lives and so on. So first of all, you're focusing on a very important issue locally. Also globally, if you're third in the burden of disease, that's what happened with pandemics, right? They tend to cross borders. They don't stop in one country. We all know that now after COVID-19, if we didn't know that before. So there is both a local interest in this research and a global one. Now, when you talked about potential biases, you mentioned maybe some hint to what might be the case locally. I'm wondering if you have more examples, but So you talked about, I mean, I know that there was a big gap between the rural areas and like, you know, like the very far areas in Africa and in Uganda. So that might be one difference. Also, I know there are a lot of languages. Is that correct? Like a lot of, so in a way that might also be an interesting issue in Uganda specifically. But then if I understand correctly, your tool is not aimed at each and every individual who's going to use it on their cell phones. So in a way, maybe the issue is not such a big problem, because if I want everybody to use their own cell phone and not everybody has a cell phone, it's harder to solve that. But if it's only, let's say, local clinics and so on, so if you get one cell phone that could be used for 100,000 people or 20,000 people or 1,000 people, that's maybe a simpler thing to solve. So I'm wondering if I understood correctly. And I'll just add one more thing. So if it's a global bioethics issue here, like for me in Israel, it's really important that you succeed in that. First of all, because I care, but also, well, people could have malaria theoretically in other countries, right? It's not. So, I mean, what you're doing, am I right to say that it could be used everywhere in the world? Is there a serious difference between detecting the malaria in one country and another or not? So these are like my questions plus my thoughts.
Okay, thank you very much. I'll begin with the relevance actually of the tool. Is that if we have a setup at a given health unit, we don't need everyone to have a cell phone. And that's where it comes in handy, because we don't need to have like 1,000 phones at a given health center to be able to carry out a diagnostic. So in its own way, it's a cost-effective, we believe it's a cost-effective measure. Once the setup is at a given health unit, all you need is one smartphone and one microscope. And in a way, it can be able to, you know, support. So that's the clarity that I wanted to give out in that lens. Yes, is it a local or a global opportunity for us to leverage on? Whereas apparently we are developing it for Uganda, but we believe that this is something that can even scale out to all countries that have an endemicity in malaria, and not only in malaria, but all microscopy disease challenges. So we believe that once it evolves and it scales out, we are able to, you know, create and scale out the solution to all the different potentially microscopy disease challenges all over the world. Are there different types of malarias in Uganda or elsewhere? And it could then, is there a way that the tool can be leveraged to solve probably different scenarios in different countries? To some extent, yes. To some extent, no. And how no is that when it comes to, for example, the data, apparently while we were carrying out, we wanted to study the different mosquito species. This is malaria species. And around the central part of the country is that mainly their most dominant species is Falciparum, if I may use a healthy terminology here. The limitation to that was that we didn't have any data that speaks to other species, for example, the Makerere or any other species that may be predominant, for example, in Kenya. And that would be a very good use case to even further investigate, you know, what attributes to the presence of a given species in a given ecosystem. Is it attributed to other factors that may be worth investigating? So in a way, this generally can be able to scale across the different, but you also need to look at specific environmental factors that probably may limit or may that may contribute to a given study being conducted. So apparently, Uganda there is a northern part of Uganda that is bordering Kenya and South Sudan, and usually because of imported cases, we have some of the species coming in from the neighborhood. So that actually is contributing to one of the interesting investigations that we're carrying out. So we see in a way that we can be able to even scale it to study different, you know, attributes to all aimed at holistically coming up with a very effective solution that may not be able to speak to only a Ugandan problem, but a problem out there generally to capture all these limitations out.
Right. So in a way, what you just explained could be related to transparency, in the sense that we share with whomever is using this tool that currently the model has been mostly trained on identifying a specific type or a specific kind of malaria, and therefore it is mostly relevant for these. And there were very few cases of other types that maybe are in the model. And as we get more submodels, let's call it, or we can define it however we want, we can include that data. So in a way, once we are aware of what we have included in the data set, assuming that we know what it includes, because there is a chance we have missed something, like that something is in there and we didn't know that, or something is lacking, we do not know that it's lacking, then we strive to be transparent. It's true. It's okay. It's important to do that from a public health perspective, but also from the medical ethics perspective, if that makes sense. Yeah, Amir.
Yeah, hi. So thanks indeed, Rose. Very interesting. I was wondering, as we know, there are a lot of players like in this space, and the big tech companies, the health industry, then the government, patients. How did you manage to integrate all those players together? I see that you're working with Google and with the government, and like interesting for me to hear like how do you work with all these players and talking the same language.
Thank you very much, Amil. Like I said, the kind of research that we're doing here is not just a one-man or one domain expert kind of solution. For us to be able to integrate the different stakeholders, is that it's all based on, there is this challenge. Who are the main players? Who are the main stakeholders that can speak to it, so that we can come and sit together and talk about the problem, and in ways that we can be able to, solve the solution, to come up with a solution to such a problem. First of all, we had to speak with the people who are actually the people that are going to be the consumers of the solution, and these are the technicians out and the pathologists out there in the different healthy units who are facing, a bigger burden of the diagnostics, to in a way be able to talk with them and then understand the problem, because once you concretize the problem, then you're able to understand the magnitude of the solution and how it's going to be. Then in a way, like you've gathered us here, I believe is a way that we try to reach out to the different stakeholders, especially the governments. We can't be able to undertake such a study if you don't have any ethical approvals from the Ministry of Health, which are the representatives of government. And so it was always important for us to even engage and go and speak to them about the solutions that we intend to come up with and present to them ethically, and protocols that should be able to speak to the entire solution, and understanding what the needs and any risks that could be involved, so that they are taken care of. Patient and human subjects are well taken care of, and that is the appreciation that we wanted to bring to their table, to give us authorizations to be able to undertake. So they are very major players in the entire eco process, because one, we need their buy-in to be able to understand the solution, because they are the main advocacies for the solutions that we come up with as governments. Now, as development partners, for example, Google, NIH, and these, we really appreciate them, like Lacuna, that have come up with in the different calls that they put up, and we respond to them to be able to support the work that we are currently doing to fuel the processes, and give us the support that we need to undertake such different studies. So it has been an engagement kind of arrangement to reach out to the different stakeholders that we think holistically are going to support in the development of the tools that we do want. But also engagements such as this are very key, because we get to speak, we get to learn from each other, and we get to appreciate, the different aspects of the research that we are undertaking, to, guide and learn from each other in ways that we can, to again better improve the solutions that we're developing.
Thank you. So you mentioned, I think, that one of the major reasons that this is very needed, that you have a very small number of people who could actually sift through the microscopic samples and find out what it is that they see, so they can do maybe, I don't know, 30 slides a day or something like that, which makes sense that a person cannot do endless work. And so in a way, what you're saying is that one of the reasons, one of the major needs is that's because lack of healthcare professionals, or in this way, lab professionals that could do the work. And in a way, that's in many cases, in most of the world, the major reason that many are talking about the need, the urgent need to develop technologies that could facilitate, that could be supporting, augmenting at least the human work, and maybe later on just be kind of swiftly checked by the experts to make sure that they did the work well. So in a way, this is a global issue where we don't have enough experts. And my question actually is, you mentioned the government and so on. So one of the people here asked, well, do you have a framework for AI specifically in your country? And if not, then how do you think about what is allowed? But so I just wanted to add something to that. So you're using let's say the less risky AI in the sense that it's not generative AI that creates I don't know, something new. If I understand correctly, you're basically building a model that is trained on specific samples and is learning to tune and to become better at identifying if it is or it isn't something, right? So the creativity level is very limited, and you can have false positive or false negative, but I guess the minute you have a level of false positives or negatives that is not, worse than a human expert, then I guess you can say that you've reached a nice level. I think so. So what do you think about, well, the element of risk on the one side, and then on whether or not there should be, or is there a specific regulation in your country in this regard?
That is a very good one. I understand that the Ministry of ICT apparently is undertaking a task on coming up with an artificial intelligence policy for use, and this is not specifically for health, but a general AI framework for follow-up. It's not yet operationalized, but I've been in environments where we've been able to develop, like, we are trying to develop standards and frameworks for guidance. And I know there is a no-size-fits-all strategy out there, or a regulatory framework for AI, but it's just different communities and committees coming out there to come up with these guiding documents. I know in terms of the ethics, and you highlighted that in your beginning presentation, there is already an ethical guiding document that was put up by the stewardship of RAISE at WHO, and this was also developed under that ITU framework for focus group AI for health, and in that, those are some of the guiding tools that are supportive for now at that global level, through the guidance of different committees under the WHO. But at country level, I think that is a task that we need to follow up with the Ministry of Health to be able now to come up with a standard country level based regulatory policy or framework to follow. And so the work ahead of us is huge, much as we're developing these at global level, but we need also to bring them at country level to be able to fit in within the jurisdiction of the ecosystems where they are to be applied. And that's one big task. But also there are other initiatives. I know that the EU, while we were having a conversation yesterday under the UN for AI for SDGs, I know there are also frameworks that are being developed under the EU. The EU, UNESCO is also trying to come up with its own. So I think at some level we should have like a reconciliation of all the different initiatives that are being undertaken. And I know also under the Responsible AI for Health, there could be one that is underway. Probably you also highlight on that. So we need to learn from each other, but at the end of the day, we need a guiding document at every jurisdictional level to be able to guide the developments. And that's something that the AI ecosystem is still lacking. And it's incumbent of us to be able to, spearhead such initiatives.
Thank you.
Can I ask another question?
Yeah.
Or you wanted to say something because I just had.
No, sure, yeah, please.
So I wanted to ask you a little bit about the issue of transparency. Whether do you have some kind of educational interventions to assist people, the public? I'm interested in the public to understand what you're doing. Because of not only the history, but also the fact that you are dealing with those really massive numbers of people who will eventually, contribute data to the data sets. Or you're thinking about it?
I think that has intrigued my mind. It's not something that we've been really thinking critically about, apart from just the translations and involving them in just the dissemination works that we're doing apparently. But I think there is need to come up with a concrete framework, educational framework for them to get to appreciate not only the AI for the work that we're doing, but a general aspect of looking at AI applications, especially in health, to be able to appreciate, there is need for a roadmap on that. And I think probably further conversations into this for a follow-up will guide our further initiatives on this. More like a participatory, engagement to have them be on board and take it up. One aspect that we've been looking at apparently is just an educational tool, but specifically that is for the technicians or the pathologists, but not the general community. So this intrigues something very new and interesting to be able to follow up.
Now, maybe related to that, so the data set that you need, I would assume, doesn't need to be identifiable, I would assume. And the data points, I don't know exactly what they are, but I would assume can be limited. If that is the case, what was they diagnosed with before? I don't know what it is that you're looking at, what kind of relationship between which variables. Specifically, you're looking at whether or not this is, malaria. So it might be limited in what you need. In this regard, some would argue, and it's not a bad argument, I think, that when you construct such a data set based on, let's say, samples that you took from people within the scope of treating them or checking them and so on, and you do it within the healthcare, let's say, institute where it was done for the purposes of improving diagnostics and so on, potentially this could be exempted from informed consent because it's not research done on them and it's not being utilized in a way that maybe is not fair towards them and so on. Others may argue something else, obviously, but what I'm saying is that what Shlomit asked actually opens a very interesting discussion. And while it might be different if I'm using very personal information, such as, I don't know, what I shared about my love life or my sex life or, so on, or let's say data that could really not, that are not specific. They might be specific to me, but they could be specific to hundreds of thousands of others in my country. And in this regard, the balance, the utilitarian calculation that one may do here could lead to the assumption that the breach of one's autonomy, if at all, is very minimal to some extent, and the potential life-saving the potential of that is so hard that maybe it's a good enough reason to allow this. So it's just a thought that I'm putting out there, and I remind us that when we talk about public health, I think a lot of times people tend to consider that maybe the balances that we do between different aspects in bioethics tend towards a wider focus on the society or the large numbers, not on the expense of the individual to the extent that they have no rights, but maybe with some allowance to consider some infringements to one's rights as allowed. Let me say it in this way, even if it's not exact science. Just my thoughts. Any other people have any thoughts, things that they want to share? You're very welcome to do that. So really, Rose, I really thank you. I think for me that was really deep and meaningful to hear. And I just wanted to tell you that we're very happy to not just be here to hear your lectures, but also, as you suggested, we really meant it. This international thinking group, sharing of what's done in different countries, is something that we are very keen on preserving and promoting. So if there are especially responsibility related issues that you're thinking about, specific guidelines that you're wondering how you want to put them in place in your country, want to get a sense of what's done in other places, you're more than invited to reach out, and we'll be happy to make the connections or to make to think about things and so on. So thank you so much, and you're invited to keep in touch.
Very much. And I know that this is just the beginning of those conversations that we're going to have further, especially to speak on the ethical and responsible ways that we can be able to integrate into the AI solutions that we're developing. Because at the end of the day, it's not just about the models that we develop, but the perception that people get about the solutions that we develop in ways that they will appreciate them, they will tolerate them, and then adopt them. So I believe there is no any other fora that could be very, discussed further than the opportunity that we have here. And I also want to thank you for the opportunity that you've given me to share part of the work that you're doing, but as well as the experiences from our perspective and context. So I want to thank you very much.
Thank you very much. Thank you very much.
Thank you.
And Amir, I don't know if we already have a date for the next meeting in July. I think we're still closing the date, but once we have that, we'll send the information, and we look forward to seeing you all in our next meeting. Thank you so much, and have a great weekend.
Thank you.
So bye.
Bye.
Thank you very much.
Bye-bye.